by myself, so it's a little bit complicated. And there is my first time to being Macau, and thank you for the invitation and my disclosure. And the background I will just leave it to just we need to consider about the hostile aortic next in the EVAR, because I think there was the most difficult part in the EVAR procedure. And we also know that for those tortuous next management, we always need to first build stent graft and optimize the guide-wide manipulation to improve the outcome. But always, as we always know, we like to use the ultra-stiff guide-wide techniques to solve those tortuous anatomist, because there was deploy this graft board stable. But for those very the severe tortuous those anatomies deck, you'll find that you need to use the guide wind a little bit push. We was touch with the aortic valve, aortic arc. Then we push it to make this the guide wind to align with the central line of the aorta, and to you need to deliver the guide wind to touch the aortic valve, maybe cause some the vessels injury and maybe cause some the shock complications. So how to avoid this is we need to you control the tips of your guide wind. So you see these articles, they will give me some light to think about that. Was like directional tip control. There was articles was come from others and vascular surgeons. They invented to use the sheaths to catch the tips of the stent graft. I think was reasonable, and we'll try it, but find there was some disadvantage, because we see this sheath a little bit stiff, so it's hard to get the angle and we cannot to catch it. So how to get a better solution? It was my try to solve this problem with the innovative techniques in the guide wind control. And I will show this case with under 83 years old male, and which combination with the abdominal mass with history smoking and alcohol used, and we see this image. It was like disaster, because you will see the descending aorta, and see this aortic arc it's hard to manipulate the actual stiff guide wind in there, and when we push it, maybe it'll cause some and maybe tear of the vessels, maybe cause some the shock, and also you will get very to charge the next of the anatomy. And also you will see a very huge the internal arteries aneurysm. So there was a preoperative angiography. We could get the same result. And then we do the internal arteries and embolization. Then there was the point of the date. And the first I will come from his intralaterals and assess. They use the snare, and also with combined with the sheath, and then with the catch the stiff guide wind from the main body side. If we catch that, you see this, then and then we'll test the stability of the guide wind control. And you use the standard wide, you need to pull a little bit, and by the assistance, and try to keep that stable. Then you push your guide wind. You see there was the guide wind, the central line of the aorta, it was aligned with the guide wind. Then we'll get the best result. Then we'll followed with my with this long sheath, and to follow and then to push the stent graft inside. You will see, and when you deploy this stent graft, they will follow the big curve of this aorta, and see the shape and the central line of the aorta, and the guide wind was totally aligned. Then there is the deploy it, and do the angio to check the proximal position. Then the post dilate for the proximal the sitting zone, and we also use controlled by only the one structure. and post-dilate and overlapped, and there was and followed with the deployed of the iliac extension. And after that, we get the best result, and I think the result is the acceptable. And with these techniques, done with the 9 cases, just end our follow-up last year. And the 7 cases was from the gold. I think it was first from the C3, and this stent graft was the. But we know we have the more better. We have the better stent graft from gold, like conformable. So this techniques maybe was not my first line and the techniques, but also we will choose to use the 2 Medtronic and the stent graft. I think this techniques was not just suitable for the only one stent graft, but also for other. So the operative time was the acceptable, and there was not caused the major complications. So I think that was good. So later for my summary, just the real time, the guide 1 control during this deployment was you can adjust your stent graft's position dynamically and to align with the aortic central line. And then the critical part is under control. The total procedure was under control. You can push your guide 1 a little bit, maybe pull back a little bit. You can control the level of your stent graft. And so I want to name it. So I look for some of the pictures and some of the stories. This seem like a little bit like cowboys. Yes, to use the lasso to you see the cowboys in the U.S. Maybe you're a cowboy in China, and they was also use like lasso techniques. So the key point is to capture your guide 1 and the controlled and the manipulation of the stent graft and the deploying the stent graft. But I think that maybe in the future we have the more better stent graft. We maybe solve a lot of problems. And for those Tortuous next Tortuous AAA, maybe this technique was not the first choice in the future, but I think it was you can use the backup techniques. Yeah. The last to introduce myself, I come from the Xiamen, was in the southeast of China, and welcome you all, and thank you.